So after rotator cuff repair, people wear a sling. They use that sling for about 4 weeks. The key with that is they're not actively lifting the arm at all after surgery. There are some exercises that are going to be done, which are started the first day after surgery, and I'm joined here today by Jack and Nicole from Park Physical Therapy, who are going to help demonstrate these exercises. So Nicole here today is wearing a shoulder abduction sling, which is a sling that I'll use after rotator cuff repair. The nice thing about this, it helps to hold your arm a little bit more towards the side. A regular sling, your arm's kind of here. It also takes a little pressure off of your rotator cuff. This has a couple little bells and whistles. It has a little strap here to prevent your hand from moving forward. Another strap here that you kind of tighten down so that your arm doesn't move forward in the sling. And then of course it has this pillow that helps keep your arm a little bit away from your body. So Jack and Nicole today are going to help demonstrate what pendulum exercises are. These are exercises that are started the day after surgery. They're done for 1 minute, 5 times a day, and that helps to get your arm moving without actually lifting your arm and pulling on that repair. The other thing is that physical therapy, you're going to do passive range of motion, meaning that you're going to be lying down and the therapist is going to be moving your arm, but you're not actively moving your arm in any way. You're not lifting your arm with your other arm, and certainly there's no strengthening. Strengthening only starts at 8 weeks after a rotator cuff repair.
All right, Nicole, so this exercise is called pendulums. What you're going to do, you'll flex at the hips, all right, and rest your hand on the table, and I want you to stagger your feet, all right? And the key to this exercise is to make sure you're using your weight shifting to have the arm move. So lean onto your left foot and then to your right foot, nice and slow. You're going to do this for 1 minute, okay? And you just want to let the arm dangle so gravity could take hold of the arm. Right, so what we're going to do here is called passive range of motion. This is within the first 4 weeks of your rotator cuff repair. All right, so passive range of motion is when the therapist, myself, does all the movement for the patient. The patient's not involved in not helping me, not doing anything to compromise that surgery. So I'm going to hold nice and easy, and the patient's going to tell me when I have pain. She has pain, I should say. All right, I'm going to come up. All right, so this is only going to be worked in 2 planes of motion. This is called flexion, shoulder flexion. Okay. Good, and you're always feeling if there's any tightness or any pain. And the next motion that we do in therapy for the first 4 weeks is external rotation, and we can't go beyond 30 degrees, which is approximately the tip of the shoulder here. All right. So the arm's at the side of the body, and again, the therapist is performing passive range of motion, moving the arm to the side of the body. Okay. If the patient does have pain in this position, we need to put a towel where my hand would be underneath. All right, and again, only to the tip of the shoulder and back. And this is only for the first 4 weeks.
At the end of 4 weeks, patients are able to get out of their sling, and at this point in time, they can start active assistive range of motion, meaning that they can do things where they assist their arm to get their arm up, such as pulleys, lying on their back, pulling their own arm up over their head. From 4 to 8 weeks, this is what they're doing. What they can't do is any type of lifting, and again, they can't do any type of strengthening, meaning that they're not lifting anything of weight.
All right, so the next exercise is an active assistive exercise. All right, it's called the pulleys. So if this was her affected arm, so the right shoulder had surgery, she's going to use her left arm to assist her right arm overhead. So for the most part, the right arm's going to go along for the whole ride. All right, and the left arm's doing most of the work. Again, she comes up into gentle pain and a little bit of a stretch. She comes back down, and she'll perform this for approximately 2 to 3 minutes. All right, so this is another active assistive exercise. All right, so the right arm is affected using a cane, and you want to position the arms in neutral. All right, so the arms are not folded down or folded up. They're in just like this, like a karate chop grip. All right, and the patient is going to take her left arm, again doing most of the work. She's going to lift up to the chest, all right, and then coming overhead and gentle pull at the end of her range of motion. The left arm again is doing most of the work, coming back down, all right, and then resting down.
At 8 weeks, for patients who are not significantly stiff, they can start doing strengthening exercises. If they are significantly stiff, there's no reason to start strengthening if your shoulder doesn't move well, and they should really continue to focus on stretching. As far as strengthening exercises, they're going to start working on the muscles of the shoulder blade and also working on the lower muscles of your rotator cuff, your internal and external rotators.
All right, so now we're 8 weeks post rotator cuff repair. All right, and Nicole is going to start strengthening. We call it scapular punches. Okay, so the first thing we're going to do is align the wrist, the elbow, and the shoulder. And she's not going to move this at all. She's not going to do this. She's not going to bend. She's not going to flex her wrist. All right, she's going to bring her fist up towards the ceiling and back down again. So her shoulder blade is doing all the movement. Okay, just like that. And she'll perform that 3 sets of 30 reps. All right, so now we're in the strengthening phase of post-operative rotator cuff repair, and we're starting with internal and external rotation. Okay, so the patient's standing. I'm going to have the patient start with their arm by her belly button. Okay, maintain a 90-degree angle through the whole motion, and she's keeping her elbow tight to the body and bringing the arm out until it's in line with the shoulder and back down to the belly button. She'll perform that 30 times in a row.